30 years, starting as First Lady of Arkansas, where I headed a task force to improve rural health care. And most memorably, of course, back in the early 1990s, and I still have the scars to show from that exercise. But I've also learned some valuable lessons that have shaped how I approach healthcare reform today. First, I think we have all learned that America needs to provide health insurance for all Americans. The last 12 years have shown how left on their own, this crisis and those who contribute to it, and people from all quarters of our economy will see our situation deteriorate. A growing number of CEOs and union leaders are coming together because they agree that now is the right time to renew the national call for quality, affordable health care. When Andy Stern, the president of SEIU, stands with Lee Scott, the president of Walmart, and they both demand health care reform that covers everyone, you know we're ready for change. Second, I learned that people who are satisfied with their current coverage want assurances that they can keep it. Part of our healthcare system is the best in the world, and we should build on it. Part is broken, and we should fix it. The first rule of medicine is do no harm, and we will do no harm to the parts of our system that are working. Instead, we will build on them. That means not just expanding coverage, but also cutting costs and improving quality, so that we will have health care for all and better health care for all. Because we need to address the concerns of those who have insurance as well as those who do not. That's why I started my path to this place here at Broadlawns with a series of healthcare speeches. I gave a speech on lowering healthcare costs, which helps everyone in the system. And I gave a speech on improving quality, which also helps everyone. Third, I learned how important it is to present a plan that is clear and easy to understand. Today's plan is simpler, yet still bold. Now I know my Republican opponents will try to equate health care for all Americans with government-run health care. Well, don't let them fool us again. This is not government-run. There will be no new bureaucracies. You can keep the doctors you know and trust. You keep the insurance you have if you like it, but this plan expands personal choice and increases competition to keep costs down. Fourth, I learned about how to build the national consensus you need to get health care passed. My plan is the result of discussions with many people, doctors and nurses, hospital administrators, employers, unions, and most importantly, America's families, who are frustrated with the system we have now. I've been asking a lot of questions and doing a lot of listening. Having spent 6 years in the Senate, I know that fixing health care will require political will to get the votes we need. And it will take a movement for change, a solid national consensus for reform that can withstand the attacks of the special interests. And I will work to build that movement throughout my campaign and as your president. Because in the end, change is just a word, unless you have the strength and experience to make it happen. These are new times, and this is a new plan. And when it comes to healthcare reform, I believe I have exactly the experience we need to get it done in my first term as president. Now, while I was disappointed by what happened in 1994, I did not give up. I continued the fight. I worked to expand coverage step by step, person by person. I began working to expand and improve health care for children, helping to create the state children's health insurance program. You know it as the iHawkeye program here in Iowa. That program provides insurance for more than 6 million low-income children. And I worked to create the Vaccines for Children program. Today, childhood immunizations are at an all-time high. I work to ensure that new prescription drugs are tested not just for adults, but for children too. And I wrote legislation in the Senate to get that accomplished. because children should have access to the best and safest treatments and cures available. I also worked as First Lady to ensure that breast and cervical cancer treatment would be covered by Medicaid. And I helped to establish the commission that recognized Gulf War illness as the serious problem it is for our vets who served in the first Gulf War, and we began to address it. In the Senate, I worked to expand health care to our men and women in uniform. Believe it or not, many of our National Guard and Reserve members, the men and women who've been called to fight in Iraq and Afghanistan, did not have health insurance for themselves or their families when they were activated. I'm proud of the legislation I passed to address that glaring problem. I've been fighting more generally to improve health care for veterans because it is outrageous that so many service members are returning home and being told to take a number and wait in line for the health care they need. And I've passed what's called the Heroes at Home legislation that helps those affected by traumatic brain injury and supports their families. I'm fighting to improve care for our seniors, to lower prescription drug costs by empowering Medicare to negotiate with drug companies and by allowing imports of our drugs from Canada at lower prices. And finally, following the horrific attacks of 9/11, I fought the EPA and the Bush administration when they claimed that the air at Ground Zero was safe. Safe for our first responders and emergency workers. Safe for our construction and building trades workers. Safe for our residents and our volunteers. It wasn't. So I fought for health care for all of the first responders, the workers, the volunteers, and residents who have gotten sick, and some have even died. And I will keep fighting to protect them until they have the care they need. I know that reforming health care takes a consensus for change. That's what I've been doing, building that consensus vote by vote, working to bring people together, to get my colleagues from across the aisle to join our cause. Unfortunately, back in 1993 and 94, too many of our opponents adopted a strategy that amounted to just say no. They said no, not just to our health care plan, but any health care plan. And the current administration hasn't even tried. In fact, the president's most newsworthy contribution on health care was his recent threat to veto coverage for low-income children. Well, today Americans are impatient. We've seen that doing nothing makes the problem worse. We've gone from 39 million uninsured in 1994 to 47 million today. From spending 14% of our gross domestic product for health care to spending 16%. And now we are spending 50% more per person than the next highest spending country in the world, Switzerland, which has high quality and good outcomes for the people there. So today, we're spending more money and covering fewer people, and too many of our families are paying the price. We know we have to act. And so if the question is that union leaders and employers can come together, if the Mayo Clinic has just done an extensive survey, including 400 experts, coming to a report urging that we have health care reform, if Democratic and Republican governors and legislatures can work together on health care, if doctors, nurses, patients, hospital administrators, CEOs, small business owners can all agree that it's time for a change, then why can't Washington? I believe that together we can change Washington by sticking to our principles and reaching out to find common ground. America faces a choice: continue the status quo as more and more people lose coverage, or change our system to cover all of our people. I believe that it is America's choice to do something about health care. America's choice to tackle problems of cost, quality, and coverage. And it should be of every American's choice to have the kind of health care that they want. That choice is at the heart of my plan. I call my plan the American Health Choices Plan.